Hi, and welcome back to our podcast series from the Axis Culture Group, where we believe leadership and culture come first if teams and organizations are able to thrive and able to grow. But we know this is never simple. I'm Dr. Nichola Ashby, and we also have with us Dr. Sharon Black. And each episode, we're going to explore those complexities of leadership and of culture, while offering some real solutions for those aspiring, those new, and those experienced leaders alike. But the really exciting thing today is that we have our first guest. We are joined by Professor Laura Serrant, who is a globally recognized leader, an academic, and an author. And she is going to tell us about the Lioness Effect. Professor Serrant, do you mind if I call you Laura?
You can call me Laura. Please do. Lovely.
Fantastic. Thank you. Laura's spent most of her career championing inclusive leadership, and that has grown with her reputation around this area. She's an expert in cultural awareness and the power of owning your own story. And she's advised governments, international bodies, shaped healthcare policy, academic institutions, and inspired leaders right across the world and every sector, leading with courage, authenticity, and purpose. So in this conversation, we're going to look at what it takes to build that culture, that true inclusive culture of trust, and how leaders can navigate that complexity without losing themselves along the way. And why inclusion is not just a value, but it's a practice that we actually all need to consider. So get ready for the insights that will challenge your thinking, spark your reflections, and equip you to unleash your leadership potential. I'm going to start with you, Laura. Please tell us about your journey. How did you get where you are?
Who knows how I got here? Anyway, just first to say thank you, Nicola, and thanks, Sharon, for the invitation. How did I get where I am? I suppose the way I would summarize it is I got here by a mixture of intentionality and also being open to opportunity. If I go right back, and I've been in kind of health and care and this sector for coming up to 44 years now. And originally, my plan was to be a doctor. My plan was to be a doctor and to be a GP more specifically. And that really came from my lived experience. I was born into a large family in one of the poorer areas of Nottingham. And one of the things I noticed was lots of the people around us, their parents, etc., were ill, or people had got some kind of sickness or illness. And so I was really interested all the time into how can I stop people's mum and dads being sick. That was really the interest I had in that. And so through school, my idea was that I'd work in medicine and that I'd work in general practice and help people to be well at home. I did my A-levels with that in mind. I made my UCAS application, although it was UCA in those days in the 1980s, application with that in mind, and even got a place offered at medical school. And then I went to the open day, because in those days, the open day came after the offer, not before as it does now. And during the open day, and lots of medical schools had a real focus on widening what we would now call widening participation. So they were looking to include many more medics who came from comprehensive school or non-private school background. And when I was there, the longer I was there on the open day, the more I decided this wasn't really for me. It didn't seem to focus on what I wanted to focus on, which was really, I know now, around giving people more of an equal chance of good health. Most of the people I spoke to really just talked about becoming a consultant and therefore getting away from having to do those slog around patients and hours and actually living the life on the golf course. Well, that's what it seemed like to me anyway. So I decided I wasn't going to do that. I came home having travelled to London on the train on my own. And I came home and told my parents I was no longer going to be a doctor, much to my mother's horror. She practically took the vapors and took to her bed for about a week. And I didn't know what I was going to do. What I did know was I wanted to go to university because I wanted that experience. And then one of my careers teachers, when I went back to school, said to me, if you want to do health and you want to go to university, do you realise that they've started doing degrees in nursing? And so I'd got many nurses in my extended family. And within the Caribbean, certainly it was a very revered and very important profession. So I decided, okay, then I'll be a nurse. So that on that basis is where I started. But through my career, the focus on equity, social justice, and people having the right chance to just have an equal chance of a good life is the thing that's kind of followed me. And with that in mind, I've taken opportunities where I felt things were interesting, or I would learn more about how we could do that, and then learn how to change the context that we work in and live in so that people do have a better chance of health and life.
Wow. I bet your mother
Yeah.
was really a little bit distressed when you came back. Maybe she thought you weren't even
More
going to
than a
go
little
to
bit distressed. You
university.
can imagine. You can imagine. I mean, from a poor family. I mean, I was even in school. I think some of the teachers were horrified because to actually not many pupils in school got places at that time. I mean, we're talking about the late 70s, the early 1980s. Got places at medical school who were not from, a certain demographic, should we
Yeah.
say?
Mm. Do you feel that that was the right choice looking back?
I think it was absolutely the right choice for me, and I think that it gave me a freedom that I think I wouldn't necessarily have had within a medical career. I think with colleagues and friends, I've got lots of friends and colleagues who are really excellent medics in various, working in various ways. But it was a lot more, certainly in the early 80s, late 70s, early 80s, much more regimented kind of pathway you had to follow. And they realized much more of their freedom after they got to consultants and further stages. The thing with nursing, and certainly doing nursing as a degree student in there, was that there were many challenges, but there was also freedoms because no one really knew where we fitted in. So there was more openness for us to kind of have a go at things and try different things. I mean, it was a 4-year degree program. I did at what was Sheffield City Polytechnic, which is now Sheffield Hallam University. And it was one of the few places in the country that did nursing degrees,
Yeah.
which now are commonplace. I mean, if you think I entered my undergraduate nursing training in 1982, and it only became an all degree profession in 2013. So that's a huge difference in time. But as part of that program, which was very forward thinking, we studied what we would now call, multi-professional learning. We had lectures with the physiotherapists. We had lectures with some of the medics. We from a different university. We had an opportunity to do what is now called an elective. So in our 3rd year, we could go and work in another system elsewhere. Lots of us went abroad and worked overseas for a period of time. I mean, this was even forward thinking for some
Wow.
programs now. So I think that really opened my eyes to the diversity of opportunity that you can have within that profession. And certainly we were never kind of trained or brought up to think that we qualified and then we'd work on a ward.
Yeah.
We worked at all in many, many places, including, in hospital setting, in community, all over the place. We were not restricted in the way that some of my other friends who did the traditional course were in terms of what they did.
It's
That was
really
really
interesting.
innovative.
Yeah, really interesting. Yeah. It can, like you're saying about, that was in 1982. And, uh, I was just reflecting back about, I don't think there were many degree programs around at all in
No,
when you
there were
started. So
5.
yeah, I was going to say just a handful, wasn't there? Yeah. So
Mm,
yeah, really
there was.
innovative. Yeah.
There were a few more in Scotland, but certainly
Yeah.
in England, there was only 5.
Yeah, we didn't do a degree in my training.
Normally.
We didn't even do a diploma. We did the
Mm.
RGN, but our elective was exciting because we went down a coal mine. So that
Yes,
was quite an exciting thing to do. So there are lots of opportunities there, I think, that opened up nursing coming through the 1980s.
yes.
Maybe we haven't progressed that much further forward from that. What do you think?
I think in some ways we've progressed way beyond. I mean, if I think of some of the undergraduate, when people qualify as nurses or as healthcare professionals generally, AHPs, etc., their scope of practice is much broader than what it was when I qualified. I mean, the things that we would count as an extended role, as it was called then, is actually just, business as usual for undergraduate students. But I think what's happened is that while the scope of practice has grown bigger, there's very few things that have been removed from the scope of practice. So students are trying to cover a much broader range of things than I ever had to do. I think also what's happened is that the sheer number of people going through a program at a time creates some restriction in terms of having, non-traditional things that you can do. So the opportunities to trial things out, to do things, to give something a go, which is not necessarily mainstream practice, is much less. So I think it's, in some ways we've advanced the scope of practice, and in other ways we've reduced the curiosity about nursing and healthcare practice that perhaps there was when I did my training. But then there were only 30 of us in a group. So taking a group of 30 people, as I say, we went down the coal mines, or to say that we went into industry, or we went to go and look at other, do some research and visits to different parts of the city. That's fine. But, 300 plus people all marauding around is a whole other thing altogether.
Yeah, that's very true. How do you think that started your journey into leadership? Do you think it was that early?
I think it probably my journey into leadership probably started even before that. Culturally, I was by accident of birth, shall we say, born into a leadership position within the family, because within the my family, my culture, it's very much a matriarchal society, is probably how I would describe a matriarchal culture. And although I wasn't the eldest in our family, those before me were brothers and those after me were girls. So I was kind of always positioned to be in charge, inverted commas, even though I was the middle child. And so being used to kind of taking responsibility, looking after other people, being the one that had to report back or send the messages out, was actually part of what I had done from being a very small child. Which when I then went into doing my nurse training, was something that, in the early 80s, there was lots of, social injustice. We were off the back from the 70s of, I mean, there's austerity now, and, high cost of living, low employment, sorry, the 3-day week, we had, the miners' strikes, we had power cuts. So we'd come off the back of all that. So actually, when I went into nursing, what I was seeing, certainly training in the North, was, the consequences of that, how things like the closure of the steelworks and the mine, etc., in Yorkshire, how they were played out in families and communities and health, and so that was there. And alongside that, very similar to what we're seeing just recently in society, there was a huge backlash around racism and misogyny and all sorts of things around people, being afraid for themselves, but also that kind of, tension that comes when you have multiple communities in need, or who are not the top of the pile, who are all trying to make sense of why they're still at the bottom despite all the work that they're doing. And so the infighting, I suppose, that we see now, we saw then. And that was played out in my nurse training. So again, as the only Black student on a program that people didn't really understand, I remember someone saying, well, what kind of degree have you got? And trying to explain that we were undergraduates doing nursing. The question that we still hear now, well, why do nurses need degrees? That was haunted us from then. But on top of that was the overlay of doing placements and practice, where patients and families would refuse to have me look after their people because they didn't want a Black nurse. Equally, at the same time, I would go on placement, and on more than one occasion, when you do a placement, for those people who are not maybe nurses or have no healthcare practice in the UK, first thing you would do is introduce yourself to the nurse in charge, usually the sister or whatever, on the placement, and they would assign you someone to mentor you while you were there. And I remember going on placements and the sister saying, on my first day, just as I arrived, well, you're not going to get a good report from me because I don't agree with degree nurses before you've done anything. And equally, being assigned to someone to be mentoring, that mentor saying, I'm not going to mentor you. You'll have to just do whatever you can do. So if you think about all those things together, I think made it hard and very difficult, but equally it then pushed me to speak up for myself. So in terms of self-leadership was, which, I had kind of indoctrinated in me from a child. It was helpful to lead self and lead other people. So the leadership started long before any titles or role that officially gave me that position. And I think that fits into my approach to leadership, because leadership is about presence and intention, not about position.
I agree. And that's something we
Yeah.
spoke about in our last podcast. It's not something that comes with a job title.
Yeah.
It absolutely isn't. Do you think that the culture today has moved very far from the culture in the 1980s, or are we seeing traits that are similar that stop the development of those leaders?
I think we are seeing traits that are similar, but I don't think that should be confused with saying that nothing has changed. I think there's been great strides made that have changed, and you might think that, here we go again, but actually we are experiencing some of the injustices and some of the backlashes in a different context now. This isn't this isn't the norm. This isn't something, whereas in the 1970s, it was the norm. It was the norm for that to happen. We are now seeing the reaction to the exception to the rule, or to an extreme reaction to the rule. And I think we mustn't ever get pulled into thinking nothing has changed, because I think that is where, it's easy then for us to lose hope. And I think if we lose hope in leadership and hope in humanity, then we're all done then at that point. I think we are seeing the traits, because I think the ingredients that create that scenario are still there. So, for example, large amounts of poverty, people's unemployment, people feeling that even where they are employed in 1, 2, 3 or 4 jobs, that they're not necessarily being able to make ends meet, people having to wait inordinate amount of times for treatment, and they're not appearing to be that. All those things are the ingredients which create the perfect storm. And in that perfect storm, when you then get people in positions of power who will kind of, if you like, shout at each other from the extremes rather than discuss in the middle, then that's the perfect storm that's created. So I think we are seeing the traits, but that's not the same as saying everything is exactly as was.
Do you mind if I just ask a question around, because I'm really interested, and it's something that I reflect on a lot, around being in a position of leadership and being a leader. What, from your point of view, is it about an individual that makes them a leader? Because you can learn leadership theory, you can read about it,
Yes.
you can learn it, but having the knowledge about leadership theory doesn't necessarily automatically make you a leader. So from your point of view, what is it?
I think that the two ingredients that fit with this, and it fits with my, with my approach to leadership, which I know you're going to ask me about the book and everything, but, I talk about leadership as something around the Lioness Effect. And the Lioness Effect comes from thinking about the natural tendencies of the lioness in the wild. And the two words that hit me when I think about the lioness and how she enacts her role and her position within the pride, and how the importance of not just what she does but how she does it, is having integrity and delivering impact. And I think that's what makes a difference between the leadership theory and actually being a leader. A leader acts with integrity, but also delivers impact. If you're just acting with integrity and not delivering any impact, to me, that's not really leadership. That's just a nice person, or a good person to work for. But in order because leadership has to be directional, it has to be taking yourself and people towards something. And that means that, it needs to make progress towards something, and that's where the impact comes in. Now, the slight, someone's once asked me, so how does then a leadership role fit into that? Okay. And I think what a leadership role does is add on top of the integrity and impact, responsibility. Because when you're a leader, your responsibility is self-assigned. You take responsibility when you make a determination in where you're going, and you choose to take on responsibility for making sure the journey is filled in. When that responsibility is written down and written into your actions, reactions, and responsibilities within a role, then that's when it's a leadership role as opposed to being a leader.
That leads us really nicely, thank you, into us talking a little bit more around your book and the Lioness Effect, because it fascinates me. The Lioness Effect is such a strong title. What made you think of that?
It's interesting because the Lioness Effect has come out of my research and my work, which has built up over the last. In my head, I won't say 10 years, but when I realised that I finished my PhD in 2004, I realised that it's like 21 years ago. I mean, how is that even a thing? Anyway, so originally, when I did my PhD, which in that PhD I focused it on the first AIDS pandemic, when I was a nurse working out in the community. And that was when what came together was really my interest that I spoke about before around social justice and giving people an equal chance. Because this was the first time in my living history that actually we'd had a global pandemic, which had also a moral imperative and a social backlash. And on the back of that, trying to ensure that people who were diagnosed with AIDS, I mean, because this was pre even the isolation of the HIV virus, actually had an equal chance of just good care or being treated like a human being. That's where that came from. Out of my PhD, when I tried to understand how this was working and how this was playing out, I developed a concept called screaming silencers. And screaming silences is based on areas of knowledge or experience which are usually silent or silenced in society. Like, we can't talk about it, we don't talk about it, we don't do it, but we all act as if it doesn't exist. From the screaming silences postdoctorally, I developed a research framework called the Silences Framework. And that had four phases. And that framework's been used nationally and internationally in many places in Brazil, to my knowledge anyway, at least in Brazil, on other continents, for doctoral and postdoctoral study, for intervention studies, for all sorts of things. But when I then started developing more of my independent business work, I used the Silences Framework and the basis of what is it that we don't know, and how do we actually conduct ourselves and our work in a way that we enable voices to be heard, that we enable people to give the best of themselves, and that we create an environment in which people have an equal chance of success and progression. And from the Silences Framework, developed my business model, and the business model has developed into the Lioness Effect. So that's where the Lioness Effect comes from. So although it's relatively new, and as you know, hot off the press, only last week did I receive my certification for the trademark of the Lioness Effect. Hooray. It's actually built on 21 years of research and evidence.
I think it's going to have a huge impact. I know there's
I
a
hope
lot
so.
of excitement
Yes.
out there waiting for this book and waiting for us to hear a little bit more about where that's going to take you, Laura.
Yeah. I think in this day and age, as we sit here in the 21st century, and we sit at a time right back from, I mean, it didn't start from there, but it seemed that it reached a peak with the death of George Floyd and all the rest of it, where we're at a juncture where in society there is so much talk of division. At the same time, the counter narrative of the humanity of us all. I think for me, that was where look into nature, if you like, look into the natural world for something that connects what we're trying to do, certainly around leadership and what we need in the world today. That's what's led me to the Lioness and learning not more about the thought. This is the Lioness Effect. The effect of this kind of leadership has the effect to save the world. It has the effect to reconcile us with our humanity, but also to deliver impact. So it's not just everybody just being in a nice warm bubble. It's actually towards something. And for me, at this time in the world, the impact has to be moving us towards a social justice, moving us towards an era in which each person has an equal chance of not just surviving, but actually living their life. And it doesn't matter where they are, where they're from. And it's the life that they want to lead. So, the uncomfortable part of that is that, that also leaves space for the disruptors. This is not about making everybody the same, but this is about recognizing what we need to do and the world we need to create so that we can all kind of move along, not at the expense of somebody else, but actually clearly with our own intentionality, recognizing our humanity, which means the things that we're not very good at as well as the things that work well, but actually maintaining our connections.
Yeah, and I think it's, for me, it's those two words that really resonates: equal chance.
Equal chance.
And that gives you a choice, doesn't it, as well?
It does.
Yeah.
It does.
Yeah.
It does. Because, it's about just creating the space in which people are able to make that choice openly. But then also, if you recognize people's humanity, you also recognize that they may not make that choice.
No, absolutely. Yes. Yes. It's here, you choose. Yeah.
It's here you choose, as opposed to there is no choice. Because one of the things I constantly battle with a little bit in my brain is, if we were able to force everybody to do the right thing, would that be in itself right? Because would that not take away a little bit of our humanity, in which we are fallible, which we're supposed to be?
Yeah, and it's taken, again, it's that choice thing, isn't it? And you're then making choices for the wrong reasons because you're forced to make a choice rather than you have that freedom to do that. So yeah, I agree that kind of forcing people is not the right way to go either.
No, I agree. Any culture that forces you into a certain situation is not a healthy culture to be in. I don't think that grows leaders for the future either.
Not at all. And that's where we lose the integrity.
Yeah.
That's where we lose the integrity. But I think the challenge is, and I think the challenge that I see in the world today is actually us relearning or learning how to engage with ideas and viewpoints that are different to our own without actually, retreating to the extremes, if you like. If you think about a normal distribution, how we can actually enact, react, and connect in the middle where there is lots of variation, rather than, retreat to the extremes and shout across the void.
I know that you've been very vocal around inclusive leadership and inclusive cultures and environments. Do you think that the leaders of today are able to move beyond those statements? Because we hear it banded around a lot in statements. And how do they actually embed that into everyday practice?
I think leaders today are able to do it, because I think, to be perfectly honest, irrespective of whichever political party, if you like, or leadership party, or if you look geographically across the world, whereabouts you sit, there's a particular skill that you have to be able to even reach that position in the first place. So you have to be able to debate and to evidence and to argue to a certain point. Okay. I think one of the problems that we have is that when people reach that, certainly in the world at the moment, we're in a world of instant gratification and instant answer. So actually that means then that whereas people may be able to have that conversation, they are not necessarily enabled to have that conversation, because everything is literally, we want, you move in and people want the results today. Something might take 10, 15, 14 years to build up, but people want it instantly resolved. And so the pressure to give that reaction, the soundbite, it is just overwhelming. And I think that's why I say about us moving back to a space where we're actually moving back to the middle, where we're actually able to actually discuss to think, to reflect, and then to come out and to make an informed decision or an informed choice. And that's the bit that we've lost out. The space, I mean, in my silences framework, it's really focuses on what happens in the bit where that isn't spoken. But yet we are so busy moving on to the next thing that we completely miss or make no space for the silence, no space for the time to think or to reflect. And I think that's the problem. We're so busy getting to the destination that we miss the journey completely.
Yes.
Yeah.
And also the scenery around us as well.
Exactly. And everything. And often miss our stop, the bit where we should have got off.
Yeah. Yes. Well, you're not going to get off yet. That's not what's happening here.
No, that's okay.
There's still a lot more in there. The
There's still a
Lioness
lot more
Effect
to
is
say,
just
yes.
budding. That's what it is. So what would you say then for our aspiring leaders of the future? Because one of the really standout aspects of you, Laura, is that you've always been a great advocate for platforming and supporting those people around you. So how will you continue that as we move forward in today's culture?
I think this is probably a bit of the phase that I'm in now. I mean, I'm what I call my legacy phase. And what I want to say to aspiring leaders or aspirational people who are, a lot younger than me and still on the upward trajectory, I would say, is that think about legacy now, because legacy is as much about where we intend to go as it is about where we've been. Okay. And I think that's the thing, that whole question, where are you journeying to? One of the things that helped me in my career, particularly as there wasn't a preset road, because, there were many of us around, was having what I call the 2 to 5 year plan. Where do I see myself in the next 5 years? It's a really hard question when people say, what do you want to do with your life? What do you mean, what do I want to do? What, you mean the next 17 years, hopefully? But the next 5 years, people can actually imagine, what do I want to be doing? Not what job do I want, but what do I want to be doing with my life? What do I want to spend my time doing? What do I want to be putting my efforts in the next 5 years? And then if you do that, then in 2 years' time, you should be about halfway there. And what that's always helped me to do is not only is to spot the unusual or disruptive opportunity. So rather than just going on the next thing that everybody else has done, if I know where I want to go and what I want to be doing, I can spot the things slightly off left or right field that actually will help me towards that, or is interesting towards that thing. But I think for me, the most important thing has always been is to try to lead as myself. That when you get into leadership, it's so easy that everybody to have a sense of what you think a leader should be like, or what you think how somebody else has done it, that you think, oh, I'll try and do it like them. But you can only ever do it as yourself. And, that's good enough. Maybe I think possibly I've missed a few things that if I'd conformed a bit easier, I would have probably got there, but so what? But equally on the other side, I've probably gained a few things that if I'd conformed, I would have never had the opportunity to do. So I think leading as yourself, have a 2 to 5 year, have a 5 year plan, and then in 2 years, see if you're there. And if in 2 years you're nowhere near it, but you're quite happy, maybe that wasn't your plan in the first place.
Yes, that's an excellent point.
That authentic leader.
Yes, absolutely. But I think integrity is so important. And I use the term integrous leadership. I use it purposefully because authenticity is part of integrity. But the difference between authenticity and integrity for me, integrity is about action. It's about alignment in what you think and feel and what you actually do. You can be authentic, but not necessarily do anything.
How do we then think about the accidental leaders that find themselves it might not have been part of their plan, but find themselves in that position, because I think having a plan, absolutely excellent.
Yeah.
But sometimes people just fall into it, don't they? And then might not necessarily feel prepared.
Certainly I do. Yeah, in no point in any of my plans was leadership or leader in the title of the plan. It wasn't in the plan. And I suppose I could be an accidental leader, in that, by accident of birth, I was in the right position in the family. By accident of, just having a bad visiting day, I would have trundled along. In this day and age, I would have trundled along and been a doctor because I wouldn't have had that experience that I had. But the accidental leader, I think, is down to that whole thing I talked about, integrity and delivering impact. So accidental leaders like me and like other people are usually end up in that space because they're in a place where they see something isn't right. They can see that something needs to be done. They look around and nobody else is doing it. And the integrity of who they are will not allow them to just play the game, to go along with it, to pretend it doesn't happen. And that's where the accidental, inverted commas, part comes around. So their intention is not really around the leadership. The intention is around the social justice or making a change or defending something or making sure something doesn't happen or supporting someone. And in that space, that's where the leadership comes out. That wasn't their intention, but it's a consequence of their action.
Super. Thank you.
Can I ask you one more question before we start to wrap this up? Because I could listen forever on this podcast to you. Absolutely. But knowing that your career has successfully spanned clinical, academic, policy, strategic work, which has been your favourite area to lead in?
My favourite area to lead in has been around, when I say the academic, it's not the research, it's actually around the achievement of students. The best day is always graduation for me. The best day. I love graduation. It's like, I have to say, as some people cross the stage, I think, oh, thank goodness, you made it. By the skin of your teeth, but you made it, you know. And other people, I'm like bursting with pride because I know what it took for them to get there.
Yeah.
So that's my favourite part of it. I think if you were to ask me what I think's made the biggest impact, I think the impactful part of it has been my policy work, because that's been very much a one-to-many. Because I know that the contributions and all the policy work I've done has been part of commissions or with groups of people or, you know, whatever, think tanks or whatever. So certainly it's not me on my own writing all policy. But I know when I read a policy document or I read a change in the law or a statute or a process, that I can see where the conversations I had with people at a point in time have made a difference to how something has been presented. And that will outlive long beyond my own kind of, you know, human form, should we say. So I think that's probably the most impactful for me anyway.
Thank you. Thank you ever such a lot for your inspiring conversation today. And I'm going to ask you to give us a question for our next guest so that we can start our conversation off with that.
Okay.
We're not telling you who the next guest is. It's just the next guest.
Just a wild question for whoever.
Whoever.
Well, my question to the next guest is this. Okay. If you wanted to describe yourself in 3 words, what 3 words would you use to describe yourself and why?
Nice.
Excellent question.
Yes.
That's give us something all to think about, I think.
Absolutely.
Thank you. Thank you very much for your time today. And thank you for your insights across this podcast. It's been really, really helpful and interesting listening to you. I think there is something in there for every type of leader, from our leader that hasn't even left school yet, right the way through to our policy leaders who are working across ever-changing environments around the world in global positions. And I think thank you for helping us to show how you can grow into that leader, even as an accidental leader.
Yes.
Yeah.
Absolutely.
And that legacy is so important right from the very beginning. And a legacy, I think, doesn't always stay the same.
No, not at all.
It changes throughout your career as the environment changes around you and your responses to it. So I'd like to say thank you, and I'm going to hand over to Sharon so she can sum up as well. But for me, reflecting on that conversation, I think the biggest thing for me is to see somebody who absolutely may not have set out to be a nurse, but has certainly inspired so many nurses along the way, from students right the way through to senior leaders. And I thank you for that throughout your career. And I think you're only just getting started.
Well, I'm still here. Still
Yeah.
here. Still here and able to pivot.
Thank goodness.
And they're the two
Yeah.
things we need.
Yeah, and just say a
Sharon.
huge thank you. Yeah, a huge thank you from me as well, Laura. I think I'm really looking forward to reading your book. And I think, like Nichola says, something for all of us in there. But what I just do want to say thank you for is for really showing how your values and your leadership shines through in what you say. Because that's another thing that's important for me, is that you kind of live your values and what you say. So thank you for being so open and honest today. Really appreciate it.
Thank you. And thank you both for your time and gifting me some of your time.
That's
And
okay.
we look forward to that book.
We look forward to speaking to you more. Thank you, Laura.
We'll have you back, Laura, once that book comes out. That's right.
Thank you.
That's it. You can test us on it, Laura.
I can test you on it. There'll be notes to be taken.
Yes.
And to the audience that are listening, if there are any questions, please just send those over to us, and we will get Laura to answer those on the podcast, I'm sure. So great, and we will speak to you again soon. And Laura, if we don't see you before, happy Christmas.
Well, thank you very much. Well, it's my birthday before that,
happy birthday.
Happy birthday and happy Christmas.
And happy Christmas. Yeah.
Thank you
very
very
much. Being
much.
bought towards the end of the year, isn't it? But hey ho.
Oh, squeezing it all in.
Yeah.
That's what it is.
Thank you. Take care.
Thank you.
Bye-bye.
Thank you.
Bye.
Bye-bye.
Bye-bye.